Hello, this is Jorge Herrera. It's been a while I don't come out, but this is going to be a good video, a good podcast because it is important. The title of this video is Health versus Healthcare. So we are going through a difficult time now where the healthcare being insured is going through the roof. But let's look at why that is happening. There has been decades that we were lied, that we were manipulated. The American Medical Association was created somewhere like in the 1920s by the Rockefellers and some other millionaires. And what they did is they indoctrinated all those doctors. And any doctor that was practicing alternative medicine, they were called quacks, and they were made ridiculous of, and they were basically ostracized and not allowed to be called doctors. They were called quacks. And the pharmaceutical took over, and every doctor in that medical association was sponsored basically by pharmaceuticals, and they were getting remuneration, they were getting um, they were getting money, they were getting um, paid by the pharmaceuticals to to give people those drugs, and and the healthcare turned out that way. That there was nothing that they were prescribing, that the doctors were prescribing, that it was to practice good healthy habits. No, the thing that they said is, well, just take these drugs. If it doesn't work, come back to me and I will cut that thing that is not working for you. That was basically how that was set up at the time and how it grew and it became the norm. So and also the industry of food became hijacked too. By whom? By the tobacco industry. Because the tobacco industry, it was in the earliest time, it was considered something uh, that the elites will practice. So if you wanted to have some kind of social status, then you have to have a cigarette in your mouth. But once people started learning that those cigarettes were very bad for their health, then they started asking questions, and at the end, the tobacco industry was rejected. So what did they do? They moved to the food industry, and then they use the strategies that they use in the tobacco industry to make people addictive. So they use some substances, some chemicals to get people addictive, to the foods that they wanted to sell. They didn't care if the foods were healthy or not. They just care they could make that they could continue making money. So everything was hijacked that way, and there was no interest in the health of the population. They were just looking for the money that they could be making. So the pharmaceuticals and the food industry created the conventional medicine that most people know about, where you go to the doctor and they prescribe you drugs, and if those drugs don't work, then they cut you. They cut the piece that is not working. But they had no intention to learn what was the cause of your problem. And with all the addiction to the foods that they wanted to sell, then the obesity became became a problem, became an epidemic. And we needed something like the last pandemia, the COVID pandemia, where it was so blatant, so easy to see how they were not caring about the health of the people, but that they were just looking for the money. Because in things so open, so easy to see that somebody died in a motorcycle accident, they crashed and they broke everything. They opened their heads. Uh, they lost all their their members. They opened their bodies in those crashes. And can you believe that doctors actually put on the cause of death that it was because of COVID, just because maybe they might have a little bit of COVID symptoms in the analysis of their body when they did the autopsies, but it wasn't the cause of the death. The cause of the death was the terrible accident and how they broke themselves. But they put in the cause of death that it was because of COVID. So since this was so open, so clear, so blatant that they uh, openly did that, and how they killed so many people with the wrong protocols at the hospitals, then after that, people started looking for health. But still, millions of people still were convinced on their narrative that they had to use masks, that they had to put those injections on them. And if they felt bad, they had to go to the hospital and they put on those ventilators and they use protocols that kill a lot of people. So now there are a lot of people that are looking for health. And and because of all those problems with health, with the obesity and bad habits that turn into diabetes and heart problems, then those people had to go to the hospital frequently. That made insurance very expensive because those people that were sick because of what it was recommended and the wrong healthy practices, then they had to go to the hospital very frequently and take a lot of drugs, expensive drugs, and go through surgical procedures, very expensive. So that made healthcare very expensive. But it doesn't have to be that way because if you listen to alternative medicine doctors, that the ones that are really looking for your health and looking for the cause of your problem and giving you the proper advice so you eat the proper food, you eat healthy, you don't eat that much, you cut on the amount of food that you eat, you move, you do exercise, you take on sun, go out and get close to nature, that is healthy. Then you sleep longer, you sleep based on what your body asks you to sleep. And with all those healthy practices, then guess what happened? You don't need to go to the doctor so frequently. And you start learning about your body. You start learning about what is good for your body, and then you will experience health. And there are tests that you can take. You can take DNA tests. So whatever the doctor is going to prescribe to you that is based on your DNA is going to be good for you. And if you follow those healthy practices, you sleep good, you eat good foods, and you don't overeat, and you sleep a good amount of hours, and you move and you do exercises, then your health is going to be good. So you don't have to go to the hospital or you don't have to go to the doctor so frequently because you're healthy, you're feeling good. So you only need to go and to do some checkups to take an annual checkup and to check your blood so you get those results and you manage your health based on those results, and then you change whatever of the practices that you are doing that maybe are not working as good, and you change them and you change protocols and you do different exercises or you change the type of food that you're eating so you stay healthy. So you don't have to go to the hospital. And for your healthcare, then you choose policies that will only cover you if you have an accident or if you come up with a catastrophic illness. So those policies are not that expensive because you are not going to use the system that much. So that's how you can control the cost of healthcare by controlling your health, by learning about your body, and by using healthy practices that will help your body and will go according to your DNA. That's how you have good health. So if you are healthy and you are taking on those health in health insurance that is too expensive, then let me tell you that there, if you're healthy, you don't have to buy those. You can take something like healthcare, like um, impact health sharing that is affordable and it is for healthy people. So if you want to learn more about impact health sharing, contact me. Send me a message under the video that you are watching, and I will tell you about impact health sharing, and I would help you get that type of healthcare. And if you want the proper protocols to keep your good health, then contact me too, and I will share with you what I'm doing. I'm 71 years old, and I don't have any pain. I don't take any medicine, and I enjoying my health. I have my protocol of exercises, and I can do whatever I want to do. I don't have any pain. One of the things that I'm doing lately is trying to regain my my pilot license that I lost because bureaucracies and because I stopped flying for uh, many years. Flying is when you are not being paid for flying is expensive, and the last type of flying that I was doing was for the pleasure of flying, for enjoying the flying. So I had to pay for it, and it's expensive. Maybe that was the reason I stopped flying. But I decided to regain my license last year, and I can do that because I'm healthy and I don't have any issues with my health. I got um, I got my my health certificate uh, with a doctor from the FAA because I am healthy and I'm regaining my pilot license because I can do it because I'm healthy. So if you want to improve your health, if you want to pay less for your healthcare, contact me. Send me a message under the video that you're watching, and we'll have a conversation. This is Jorge Herrera, and thank you for taking a look at this video. And we'll talk next time.